Okay, I've checked my patient's orders and I know her history, and I'm going in to perform Trach care. Knock, knock. Hi, Miss Smith. My name's Nikki. I'm going to be your nurse today. How are you feeling? Are you breathing better since respiratory just suctioned you? Good. It looks like your oxygen's 96%, so that's great. I was going to come and perform trach care. Have you had that before? Okay, so you understand it? All right, well, if you have any questions while I'm doing it, just let me know, okay? You in any pain? Okay, good. Well, let's get started. I'm going to wash my hands, gather my supplies. This is my peroxide and my sterile water or saline. Put your collet up here, and I'm going to raise this bedside table, Miss Smith. I'll put it back in a minute. I'm going to raise it to waist height for sterility, and I'm going to raise your bed, side my back. Okay, put this side right down. Okay, Miss Smith. Okay, I'm going to open my trach care tray. I'll loosen my lids. I'm going to don my first sterile glove. I like to pick it up and away from everything so that it's less likely to touch anything when I'm putting it on. My fingers don't want to go in right. Oh well. Okay, so I don my other glove so that I can fix that. Okay, now, got my sterile gloves. I'm gonna turn my tray. I'm gonna make a sterile field over here. And I'm gonna take my supplies. Separate everything out. I've got 4x4 gauzes. I've got 2 pipe cleaners. I have 2 cotton swabs. I have a drain sponge. And then I have a tie for the trach if needed. Okay, I'm going to contaminate my non-dominant hand and open my peroxide. Pour this bin half of peroxide. Pour the rest of that bin with saline. This bin full of saline. Okay, so now, Ms. Smith, I'm going to take your oxygen on for a moment. I'm going to unlock and remove your trachostoma, which I can only touch the very outer part with my clean hand. And I'm going to put it in the peroxide and saline mixture. Let it sit for a minute. I'm going to pick it up by the end. I'm going to take the pipe cleaner and push it in. Try to get those secretions out. I can do that again if I need to. If not, I'm going to take this wire brush and put it in, scrub, scrub, scrub as much as I need to. And then if I need to clean around the outside anymore with that brush or with these Q-tips. Then I'm gonna let this soak in the saline for a couple minutes. I do want to put this oxygen on while I'm taking care of this, just to make sure the patient stays oxygenated. Okay, so I've let that soak for a couple minutes, and I only touch this white part with my clean hand. I'm going to take a 4x4 and wipe this off real good. We don't want any, tap, 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 tap. Wipe it off real good. We don't want, there might be a tiny drip or two, that'll be fine. But we don't want to insert anything, any water into the tray. Okay, Miss Smith, here we go. We're going back in. And now our sterile field's over, so I can reapply the oxygen. Good. Okay, so now I want to clean around the stoma site. I am going to, after I leave that oxygen on for a little bit, I'm going to take it off and I'm going to remove this yucky sponge. I'm going to take a 4x4. I'm going to pour some saline over it, kind of squeeze it out. I'm going to wash all around the area, fold it around, or get another one. Pick this up and wash it because it usually gets all yucky. Dispose of that. I'm going to take a Q-tip, put some saline on it, and I'm going to hold the trach up a little and make sure to clean real well right around the actual stoma site. Make sure you get all that yucky stuff off. I might need to wet another 4x4. Okay, everything is clean, so I'm gonna get my drain sponge now, and you always want to put it up like a V. I'm gonna move my mask again, and you just tuck one side under one part, tuck the other side on the other part, and once you get them tucked up there well, pull. Voila, everything's clean and nice. Now, the time usually doesn't get changed. However, if it's real nasty and needs to be changed, the thing to remember is, with your new tie, you would always tie it on first, go around the back of the neck, tie it onto this side, and make sure it's stable before you take the other one off, to make sure this trach doesn't come out or get dislodged or moved in any way. That's the only thing you need to remember about, or the main thing to remember about this tie. Okay, we're all done. It's so nice and clean. Miss Smith, how are you feeling? You breathing okay? I'm gonna lower this bed back down for you. I'm sorry, the old bed, so it's kind of rough. I'm gonna get all my stuff. And I'm gonna take my gloves off. I'm gonna wash my hands. I'm going to put the bedside table back down to her level. Miss Smith, if you need a thing, you call me, okay? Okay.